guys. Reading the book again. This is continuation part 6 in the series of me reading this little brochure by Dr. Neil Rosier about bioidentical hormone replacement therapy, um, done by popular demand from my patients who said they prefer for me to read this little booklet rather than for them reading it. So I figured we'll just do it right here on YouTube and you guys can enjoy. So we covered many topics in the previous 6 sections already, or previous 5 sections. This is number 6. We talked about just what is the biologically identical hormones are. We talked about what is hormone replacement therapy is for anti-aging, thyroid hormone, estrogen, progesterone, to bleed or not to bleed, testosterone for men. That's where we stopped. So now we're going to talk about testosterone for women. So when you come to my practice for hormone replacement therapy, you would get a copy of this little brochure, or if you're doing it virtually, I would send you a PDF file of the same thing. That way you can read it at home. It's just a very basic beginning on education on hormones. Obviously, there are many books out there that I always recommend for you to read, that you can get on audiobooks on Amazon, and I've mentioned them in the previous videos. I'll make sure I post them into the description videos of the videos as well. So this is just kind of like Cliff Notes, okay? So testosterone for women starts with a quote: "I feel so much like a woman again. I have plenty of energy, and sex is what it was at age 20. This is Suzanne Somers in her book, The Sexy Years. Testosterone is also a female hormone, because I know we all think testosterone is a male hormone, but it's also a female hormone. Not just a male hormone. I said that. Total hormone replacement means restoring the natural balance of all hormones to the levels of our physical and mental peaks. For women, this also includes testosterone. Even though many women take estrogen and progesterone, they still do not feel like their youthful selves. This is secondary to the lack of another sex hormone called testosterone. Even though testosterone is widely known as a male hormone, it is also a critically important hormone for women in that it plays a crucial role in the physical and emotional health of women. The pharmaceutical industry was the first to realize the importance of this, and they have begun to market a combination estrogen and testosterone tablet, which is unfortunately synthetic. The synthetic hormones can adversely affect the liver and should not be used. The safe, natural testosterone only should be used and is available from specialty compounding pharmacies. So we talked in previous chapters about use of synthetic versus bioidentical compounded hormones. Some of them are available as non-compounded, but idea is that bioidentical are literally what we produce naturally, and synthetic do not really come close to our natural hormones, so you get different effects from them. We want to stick to bioidentical version. Testosterone is produced both in the ovaries and adrenal glands of women and is an important hormone for normal female sexual development. Women also lose their libido as they age, which is secondary to loss of serum testosterone. Lack of testosterone also contributes to symptoms of menopause and lack of libido and sexual responsiveness. Replenishment of testosterone in women contributes to the enhancement of sexual drive, relief of menopausal symptoms, restoration of energy, strengthening of the bones, prevention of osteoporosis, and improvement of overall sense of well-being and zest for life. How's that? Who wants to get back their zest for life? I'm all for it. Many women do not realize that testosterone improves their skin, muscles, bones, tendons, and joints. Older patients commonly complain about their skin becoming too thin, primarily on their arms and hands. Most women are unaware that the best hormone for the skin to prevent thinning and wrinkles and increase collagen and elastin is testosterone. Many physicians and women remain unaware that testosterone is much better for protecting against bone loss than estrogen, yet it is seldom mentioned as a treatment. A small amount of replacement with testosterone gel can make an incredible difference that many women have not been able to enjoy up until now. The correct dose of testosterone replacement will be determined by body weight, age, and blood levels. So it is individualized. And even when we start hormone treatments with my patients, I can start them on some dose, and then we're going to start titrating it up or down. So changing the dosage based on how they respond on it. If we feel like, oh, it's a little too much, all right, let's slow down on the dose. Let's not take it as often. Let's take down the concentration. And for those who don't respond to it as well, maybe they're not absorbing it as well. Maybe their body is just not allowing for free hormone to actually do what it's supposed to do. They have too much sex hormone binding globulin. We need to up the dose. We can take it twice a day if we have to. So there are variations on how we're going to administer that hormone for a female. In summary, testosterone is a hormone secreted by ovaries and adrenal glands and testes in both male and female hormone. It's a both male and female hormone. It contributes to increased muscle mass, strength, endurance, decreased fat, increased exercise tolerance, enhancement of well-being and mood. There is an increase in bone density and prevention of osteoporosis, improvement in skin tone and healing capacity, and increased libido and sexual performance. It prolongs the quality of life by slowing the diseases of aging, such as cardiovascular disease, by decreasing cholesterol and increasing HDL. Testosterone is a memory enhancer and protects against the formation of Alzheimer's disease. It is equally as important and beneficial in females as well as males. A recent study in JAMA explored all of the benefits of testosterone and calling it cutting-edge medicine. The New England Journal of Medicine reviewed testosterone replacement for women and found that it best therapy for improving energy along with estrogen and progesterone. Don't confuse natural testosterone with synthetic testosterone analogs. They're not the same. Use only the natural testosterone and not synthetic. It's healthy for you and you'll feel good doing it. So that is a quick overview of testosterone for women chapter. The other remaining chapters in this little booklet are DHEA, melatonin, and then there's a little bit of a summary. So there's also some Q&A options here with responses to some of the other doctors that sometimes criticize use of bioidentical versus synthetic. So we can read it now. We can make part 7 of this video. I'll say we'll read it now. Let's read it now. So DHEA, it's a tongue twister. Dehydroepiandrosterone. Who can say that 5 times? Dehydroepiandrosterone. DHEA, we'll just call it DHEA, is a hormone produced by adrenal glands and is derived from cholesterol. So most of our hormones, estrogen, progesterone, testosterone, DHEA, they are based on cholesterol. So the baseline molecule is cholesterol. Same with this DHEA. Any hormone that is derived from cholesterol called a steroid. So when people say steroids, it can be any hormone that's made out of cholesterol. Estrogen, progesterone, testosterone, all your natural fat-soluble hormones are basically baseline cholesterol. They are actually steroids. DHEA, estrogen, progesterone, testosterone are all beneficial natural steroids. It is the most abundant steroid hormone in all of our body. DHEA has many beneficial effects. It is the building block that is necessary to make estrogen, progesterone, and testosterone. For many years, DHEA was felt to have no particular value other than a precursor of our sex hormone. So like the thing that your body uses to build the next level, right? However, researchers then discovered that DHEA dropped steadily as we aged and could be used as a biomarker to measure the aging process itself. A recent study from National Institute of Health published in, well, it's not recent anymore, 2002, showed that the only factors in humans that have been shown to prolonging lifespan are caloric restrictions and elevated levels of DHEA. So they're associating higher level of DHEA with longer lifespan. So lower levels of DHEA were associated with increased mortality from cardiovascular disease and cancer. Higher levels were protective against heart disease and cancer. Conclusion: maintain optimal DHEA levels in your blood for optimal health. DHEA improves the function of the immune system, improves brain function, relieves stress, and has been shown to be very potent anti-cancer supplement. Now, would I really believe that we're going to use DHEA in case we have cancer against instead of chemotherapy? No, I will never say that. But we can use it up to the point of, hopefully avoiding cancer. DHA also increases energy and reduces body fat and cholesterol, thereby preventing heart disease. Most of these effects are a result of a shift from catabolic state to an anabolic state or protein building stage. This has been a significant amount of research. There has been a significant amount of research published on its critical role in our health and well being, which is why it is a focus of some of the most exciting medical research in this country. DHA has been shown to increase insulin sensitivity, which means that you have less need for insulin, therefore less insulin resistance. This in turn results in protection against diabetes and greater control for those with diabetes. It has also been shown to have a significant effect in treating connective tissue disorders such as lupus, which is a disease that tends to have minimal improvement from standard therapy. Pharmaceutical DHEA will soon be FDA approved as a drug to treat lupus. I'll have to look it up and actually see if it's true. We definitely have DHEA supplements available right now. Most of the tremendous effects seen from DHEAs are based on its ability to stimulate protein synthesis within the cell, which in turn results in increase in cell regeneration and its improvement in immune function, which forestalls disease processes. DHEA is an antioxidant and as it appears to prevent the formation of free radicals. Damn, it does everything. Now remember, DHA in the United States is sold as a supplement. In other countries, like in Europe, DHA will be actually pharmaceutical agent that you have to get prescription for. Insulin resistance has led to over 14 million Americans having some form of diabetes. Insulin resistance or inability of insulin to do its job results in increased glucose, increased weight and obesity, and heart disease. A decline in DHEA participates insulin resistance that can lead to damage of the cardiovascular system. Diabetes that has been given DHEA, diabetics who have been given DHEA, has shown a slight decrease in insulin resistance, which prevents the harmful effects of insulin on the vasculature. Two recent studies in clinical endocrinology and metabolism journals have proven the beneficial effects of DHEA in preventing cardiovascular disease. The Journal of Clinical Endocrinology and Metabolism stated that there are over 200 or 2,500 published papers documenting DHEA multiple benefits. This important paper acknowledges that we produce half of a DHEA at age 40 than we did when we were 20. So a radical decline in the level of DHEA as we're getting closer to the years of andropause or menopause, which is after 40 for most of us. Some elderly people produce no DHEA whatsoever, which puts them in a significant risk. DHEA was shown to improve the quality of life and postpone many of unpleasant effects of aging, such as fatigue and muscle weakness. Patients receiving DHEA slept better and had more energy and were better equipped to handle stress compared to placebo group not receiving DHEA. Other potential benefits of DHA include immune enhancement, anti-cancer effects, anti-atherosclerotic effects, and cognitive enhancement. DHA is available over the counter and is common in the drugstores, grocery stores, and health food stores. Unfortunately, many of the over-the-counter products come from foreign countries and contain contaminants and preservatives, and therefore are not entirely pure pharmaceutical grade DHEA. The half-life of DHEA from over-the-counter sources is approximately 6 hours, which would require that one take the supplement 3 times a day. DHA should be prescribed as a sustained release, micronized form, which allows for complete absorption as well as sustained level for over 24-hour period. So basically, where you get your medication matters, thereby foregoing the need to take the supplement 3 times a day. In addition, DHEA by prescription should be of pure pharmaceutical grade that is compounded by a pharmacy to assure 100% pure pharmaceutical product. So we have the same issue of impure products with melatonin, with DHA, with pregnenolone, and many others. Let's see if there's a chapter on pregnenolone here. There is not. I'm surprised. So the next chapter is melatonin. Probably not going to read the whole thing here. Let me see if there's a summary here. Basically, I'm too lazy to read the melatonin chapter. But basically, same thing, melatonin can be used to help you sleep. Some people really use a large dose, especially if you buy from Amazon, over-the-counter areas. If you get it also micronized form that gonna last longer in your body, you will need smaller dose and it will be more effective. So same thing, where you get your melatonin matters. I had friends that were like, I take melatonin, but I need to have 20 milligrams for it to even have any effect on me. I would give her, melatonin from the pharmaceutical grade pharmacy with micronized formula of melatonin, where a small, tiny 3 milligram dose was doing what the 20 milligram dose was not able to achieve. So it definitely makes a difference. Of note, the melatonin is produced in our pineal gland, which is in our brain. It helps cells and body even out our function. So state of homeostasis. But this is something I prescribe only if people, after everything else, after balancing out all other hormones, if they're still unable to sleep well, then I'll prescribe melatonin. It has other benefits, not just sleep, but it can help with, for example, if you have to get up very often at night to go to urinate, to go pee in the middle of the night. It actually been shown that melatonin can reduce nocturia or urinary frequency at night. So if you like unable to get enough sleep because you have to get up so often to go pee, melatonin can potentially help you decrease that problem. Again, make sure if you're going to decide to take melatonin, you take it from pharmaceutical grade, micronized version of melatonin. So it basically reduces the nighttime awakening for that reason. It is also effective in females. So that's our overall overview. There's also a summary chapter, but again, you guys can get the book when you have a consultation with me. I can also send you a PDF file of this booklet. Get the real full version of the books that's available. There are books by Dr. Neil Rosier, this doctor right here, and many other doctors that talk about estrogen, progesterone, thyroid, and all of these other hormones. And make sure you find a doctor who's well versed in all of the forms of the hormones and replacement, so you get the help that you need, right? We often see patients. Yesterday I had 2 consults, and the first one actually quit her job because of lack of the hormones, because everything was just not going right. The mood swings, the hot flashes, the anxiety that comes with menopause. So many different symptoms add up, the lack of sleep, that people literally quit their jobs in the height of their career. That's not acceptable, right? This kind of stuff can definitely save lives. So I will see you all at the reading of next book. I got another book we can read. Hormones Demystified. We'll do more readings later.